The importance of follow-up appointments. That's our topic today on Ask the Hearing Doctors. Hi, I'm Jim Cuddy, and this is Ask the Hearing Doctors, and I'm joined today by Dr. Anna Anzola, Dr. Linda Himmler, doctors of audiology with Hearing Doctors, the Washington, D.C. area's highest-rated audiology practice, with over 1,500 five-star reviews. Anna, Linda, great to see you both.
Great to see you.
So today we're talking about the importance of follow-up appointments after hearing aid fitting. How many appointments and how often should I be looking at hearing aid or follow-up appointments for after a fitting?
After a fitting, we like to see patients back at least 1 or 2 times. We're going to do something called real ear measures that helps identify the gain present at the eardrum with the hearing aids on their ears, a very critical scientific method that we like to have. Then we also like to see what their reaction is and where their problem set is and where we need to move from that point to keep them moving forward in a positive direction. We also do other testing. So we have them back about 2 times, maybe 2 to 3 times. We'll do some aided testing and maybe some aided speech and noise testing as well.
And those two to 3 times, whatever it is, over how much time after I've had that fitting? I mean, is that just for over a year or?
No. We do that usually in the first 1 to 2 months.
Okay.
We'll see them back until they're settled and we think they're in a good space. They're in a good space and we let them sail until our 6-month check.
Yeah.
And then there are longer term follow-ups?
Yeah, and they are. But even if they're taking a little longer than the 3 times, we let them go a little bit more. Just because I like us to be in a position where they feel comfortable. Not just because the number says, 2 to 3 times. That's the most typical. But I want them to be at a point where they feel comfortable and that they have gained all the recommendations and they have understood all of that. And so if it takes a little longer, we'll do a little bit longer.
Everybody's different.
Yeah,
everybody's
sure.
very
So
unique.
we tend to create more of a plan for them rather than anything else. But at the 6 months mark, so like a dentist, you come in to see us every 6 months. I think it's very important, not just to check up on you, the individual, the patient, but also maybe you have different type of activities and maybe we need to reprogram the hearing aid or the system in a different way, in a different mannerism. To better help you communicate, right?
So that could be different professions or lifestyles or whatever.
Social activities, absolutely. Maybe you picked up golfing and now you need an outdoor program. So it all has to do with, what do you need this instrument or device or devices to do for you? We also take the opportunity to check the performance of that system. And so we have a box where we put them in and it gives me numbers where it tells me the specification of that system. Is it working optimally for you? Not just programming was one thing, but is it working optimally for you? Maybe there's a component that went bad and you never knew it. One of the microphones is off or dead. And so you would not know it if we didn't have that opportunity.
And Linda, you mentioned real ear measurement. What other sort of things could someone expect at some of these follow-up appointments? And
within a lot of the programming, you can even check the circuit to see if it's working. It's important to get feedback from them. We can also put them in the booth under certain conditions. If they're having issues, we can see how they're performing in a noise situation. And we can make adjustments or change a program or create a program to help them in those particular situations. It also gives us an opportunity to look at their care that they've been able to do on their own over the last 3 to 4 months, depending on what that distance has been. And we can either re-instruct them or get some habits or see if they need wax cleaned out again. And we can hyper clean the hearing aids ourselves to get them back into a good spot.
So the maintenance will also be a part of, potentially a part of these follow-up appointments.
It's always a part of it. I want to know that you're taking good care of the hearing aid and that the hearing aid is going to take good care of you when you need it the most.
So I can't adjust it well to the new sounds. Is there an opportunity to maybe try something different?
Sure. If within the 30 days there's no satisfaction, there's a lack of hearing, it's not delivering something that we intended for you to have or you wanted to have, we can certainly try different brands, different styles. I think the real ear measurement, though, gives us audiologists a really good idea. It's a knowledge, right? Are we meeting target? Is it doing what we needed to do for you in order for you to hear well?
Real ear measurement, you're looking at what it actually is.
You're
I mean, you can
looking at
see
gain
this
at- yeah,
where,
eardrum. Absolutely.
where
Per
it all
frequency
is.
is very specific.
And then that allows you, because of the technologies that you use, to really fine-tune
Fine-tune
somebody's
it.
hearing aids.
Yeah.
And sometimes the patient will come in and say they're hearing something that seems out of the ordinary, and we do earlier measures. We can identify something that will need to be adjusted, and we can take care of that at that moment.
What about longer-term follow-up visits? I mean, obviously, it's not just one and done, and as you said, you go to the dentist every 6 months and
Right.
that kind of thing. What happens in the longer term? Are less things necessary, or what?
Oh no, absolutely not. I think you add up even more so, because now you establish a relationship. It is a relationship.
Sure.
And so we find out more about your activities. What is it doing? Is it addressing everything you want? And then we test you again one more time on an annual basis. I want to know that year over year things are pretty stable, or if they have changed, then we reprogram the system to address that new audiological need or data. And then of course we go back to doing real ear to measure, are we meeting targets? Is it doing what it's supposed to be doing?
So this really is, the importance of it is obvious, the follow-up appointments and the adjustments and that kind of thing, but it's also keeping that relationship that you mentioned going and moving forward, and it just probably makes life easier for everybody.
It does, it really does.
It does. The joy.
Thank you both for your time.
Thank you.
If you're in the Washington metropolitan area and you'd like to schedule an appointment with hearing doctors, click the link in the description or visit hearingdoctors.com.